thing that a chiropractic does in an office, it gives you a form to fill up, and this form mostly it consists of your past medical history, your history, and your complaints. And the history can tell us a lot. Believe it or not, when we want to evaluate your spinal cord, if you have a kidney problem or large intestine problem or even heart or lung, that could also translate to misalign your vertebra. And I have a video about that. It's called visceral somatosubluxation. I strongly urge you to see it. But also other type of history. Or for example, if you had a history of fall, you had an accident or slip and fall, or if you had a pregnancy. Now, pregnancy itself could misalign your pelvis. Now, little slow anatomy lecture. Our vertebral column consists of 7 cervical spine, 12 thoracic, and 5 lumbar. And then we have sacrum, and then around the sacrum we have pelvis bones. Now, as soon as we finish with your history, the first thing we do, we do observation, and this observation consists of observing your muscle tones. Muscle tone, it tells you what your body has more tone and what part of your body doesn't have enough, and that could also misalign the vertebra. Then we observe your posture from the side, how much you have anterior head carriage, or how aligned you are. You need to have we call it plumb line, how straight you are versus misaligned posture, as you can see in this video. Or then we see you from the front, back to front, and you see how aligned your head, shoulder, pelvis, knees, and ankle are. And that can tell us a lot. As you can see in this picture, a person who is not very aligned from side, you can see the very low back, L4, has carry a lot more weight. After that, we do something called palpation. There's 2 types of palpation. We could palpate for muscle tone for smaller or larger muscles. And then we go for each individual vertebra and we palpate those. If they are misaligned, we could literally feel them. Also, we could see around that vertebra there are muscles between the vertebra that they could have a spasm or be in atrophy, and we feel for those. And then we feel overall fixation of your spine. And then we go all the way down and we see, as you can see this picture, he puts his finger on your pelvis, and that shows us how your pelvis is rotated. Once we are done with static palpation, we go for motion palpation. In other words, you can see in this picture, we ask you to do different movement, and we observe your spine and see how they move according to your direction and motion, and we observe where it doesn't move or where it does move too much. And when we're done with all that, if we see necessary or we suspect you have some type of arthritis or your degenerative joint disease, probably we will order you to have some x-ray. Now in my office we don't do x-ray, we send them outside. But that's the last step. Not every patient is recommended to do x-ray, but by far is a very helpful tool. And if x-ray doesn't show us anything, we would recommend MRI to see the soft tissue. And after that, we may come up with a plan, and after our assessment and evaluation, and we give you the number of visits and the frequency that we. By far, our chiropractic evaluation is a very precise, and it will pinpoint what part of your body needs most attention. Then again, I want to emphasize that The nervous system controls everything in your body, coordinates everything in your body, and misalignment of the vertebra can interfere with this control and coordination and can create disease. And that's why a chiropractic evaluation can tell you how far you are in your health, in your journey of wellness. Then again, in the quantum of the wellness, either you go toward wellness or you go toward illness. Is up to you. Have a great and healthy day.